Chicago's CARE program, struggling to transform mental health crisis response. Mental health in crisis. Chicago's CARE program falters despite promise. Imagine watching your child's life unravel before your eyes. For Pamela, a single mother on Chicago's North Side, this nightmare became a harsh reality. Her once outgoing teenage daughter's mood swings turned volatile, leaving Pamela desperate for support. But here's where it gets controversial. In 2021, Chicago launched the Crisis Assistance Response and Engagement CARE program, touted as a revolutionary approach to handling mental health crises with compassion, not handcuffs. By sending teams of mental health professionals, paramedics, and initially police officers to low-risk 911 calls, CARE aimed to calm situations without traumatizing those in need. Pamela's experience with CARE was nothing short of transformative. When her daughter's rage escalated, the CARE team responded with empathy and expertise, de-escalating the situation in a way that left her daughter responsive and relieved. If CARE hadn't intervened, things would have been much worse, Pamela reflects. People with mental illness need help, not punishment. But here's the part most people miss. Despite Mayor Brandon Johnson's pledge to expand CARE and remove police involvement, records reveal a troubling trend. 911 personnel are dispatching CARE teams to fewer mental health calls, and police still respond to most. The program's future is further complicated by the impending loss of federal COVID-19 recovery funding, which has bankrolled most of its operations. The use of mobile crisis teams like CARE gained momentum after the police reform movement surged following George Floyd's tragic death in 2020. However, these initiatives are now struggling with uncertain funding and staffing shortages. Chicago's own mental health system has been a subject of controversy, dating back to Mayor Rahm Emanuel's closure of 6 city mental health clinics in 2012, which sparked protests and concerns about access to care. The Collaborative for Community Wellness's Treatment Not Trauma campaign in 2020 demanded a citywide crisis response system that didn't rely on police. Alder Rosana Rodriguez Sanchez' subsequent proposal for non-police responses was met with opposition, with some labeling it a move to defund the police. CARE was born out of this tumultuous landscape as a compromise under Mayor Lori Lightfoot's administration. Today, 7 CARE teams operate in select police districts, mostly on the south and west sides, with 1 team responding citywide. However, dispatchers often err on the side of caution, preferring to send police or paramedics due to concerns about potential crime or medical emergencies. This cautious approach means that out of over 96,000 potentially mental health-related 911 calls last year, fewer than 1% were responded to by a CARE team. And this is the part that will spark debate. Is the current system, with its emphasis on police and paramedic responses, truly equipped to handle the nuances of mental health crises? Or are we failing those who need our compassion the most? We want to hear from you. Should cities prioritize non-police responses to mental health calls, even if it means rethinking the entire emergency response framework? Share your thoughts in the comments below. As the city navigates the complexities of funding and restructuring, one thing is clear. The fate of CARE and the well-being of those it serves hang in the balance. Mayor Johnson's office assures us that the mayor is committed to securing continued funding and expanding the program. But as the clock ticks down on federal funding, the question looms. Can Chicago's CARE program be saved? And with it, the promise of a more compassionate approach to mental health crises?